Many people in Alabama are nervous about getting the vaccine, but there is a particular concern among the African American community. This is mainly due to unethical clinical trials involving people of color. Our Nick Norman tells us how this worry can be put to rest.
Only 11% of vaccines have reached the African American community in this state.
Dr. Strickland says that it's impossible to know if that number is related to the vaccine shortage or the concern to take the vaccine in the African American community.
I poll all of my patients and try to educate all of my patients on the importance of receiving this vaccine, but there's still some hesitancy.
He found through his polls that about half of his patients of color are nervous when it comes to receiving the COVID-19 vaccine. But there are things that can be done to ease some of the worry.
The biggest issue with the black community and black patients is comorbidities, for one, high blood pressure, diabetes, but more importantly is education and access and opportunity to get the vaccine.
Education about the vaccine can help put people's minds at ease about getting one.
We need to come together and realize that there is a need to educate the black community, to provide community access to the vaccine. I think that we're going to have to go into the black community.
As well as having leaders in the black community come forth and lead by example, such as ministers, councilmen, and representatives.
You have to have leaders in the community, trusted leaders in the community, to really guide that. And then the other thing, I think it's important that folks that look like the individuals that are having a hard time accepting it should be talking about this issue more. And so people respond to those that look like them and those that they trust. And I think that we got to do a better job of that.
Putting the Valley first, Nixon Norman, WZDX News.